Hello and welcome back to my channel Med Talks with Roshni, and I'm back with the second part of the video prenatal assessment care. So this is the second set of MCQs prepared only for you. So without wasting much time, let's get started. Let's begin with the first question. In which trimester there is restriction for coitus or sex? The options are number A, first and second trimester, number B, first and third trimester, number C, second trimester, and the last option number D, throughout pregnancy. Coitus is restricted during the first and third trimester, therefore the answer is option number B. Next, question number 2. During the second half of pregnancy, the average weight gain is. Options are number A, half kg in a fortnight, number B, 1 kg in a fortnight, number C, 2 kg in a fortnight, and number D, half kg in a month. Fortnight means after 2 weeks. During the second half of pregnancy, the average weight gain is 1 kg in a fortnight or in 2 weeks. Therefore, the answer is option number B, 1 kg in a fortnight. Third question. Measurement of girth of abdomen in last trimester of pregnancy should be measured at. Options are number A, lower border of the umbilicus, number B, upper border of the umbilicus, number C, exactly at the umbilicus, and number D, none of the above. The answer to our third question is number A, lower border of the umbilicus. Fourth question. If the girth gradually diminishes beyond term or earlier, it arouses suspicion of. Options are number A, multiple pregnancy, B, hydramnios, C, placenta insufficiency, and number D, abortion. If the girth gradually diminishes beyond term or earlier, the suspicion goes to placental insufficiency. Therefore, the answer to our question is option number C, placental insufficiency. Moving on to question number 5. Which of the following weeks of gestation the mother is advised to go for ultrasound scanning to detect congenital abnormalities? Options are number A, 16 to 18 weeks, B, 14 to 16 weeks, C, 10 weeks, and option number D, 20 weeks. The ultrasound scanning to detect congenital abnormalities is done in between 16 to 18 weeks. Therefore, the answer to our question is option number A, stating 16 to 18 weeks. Question number 6. What are the findings one can get from ultrasound scanning? Options are number A, congenital abnormalities, B, gestational age, C, standard morphometric measurements, and number D, all of the above. Answer to our question is option number D, all of the above. Next, question number 7. The normal AFP concentration in liquor amni at the 16th week is about dash milligram per liter. Options are number A, 16, B, 20, C, 22, and D, 24. For a reminder, AFP is alpha-fetoprotein, a protein produced in the liver of an unborn baby. The AFP test is done to check the level of AFP in the blood. The answer to our question, the normal AFP concentration in liquor amni at the 16th week is about, option number B, 20 mg per liter. Next, question number 8. If AFP concentration in liquor amni is increased, indicates that the fetus has. Options are number A, open neural tube defects, B, imperforate anus, C, undescended testis, D, Down syndrome. Well, if alpha-fetoprotein concentration in liquor amni is increased, it indicates that the fetus has open neural tube defects. So the correct answer is option number A. Question number 9. Pregnancy above the age of 35 years has increased incidence of. Options are number A, Down syndrome, B, Peter syndrome, C, Pierre-Robin syndrome, D, none of the above. Answer is option number A, Down syndrome. Moving on to question number 10. Chorionic villus biopsy is done to detect. Options are number A, abnormalities of placenta, B, chromosomal abnormalities, C, abnormalities in the sex organs, and number D, none of the above. The answer is option number B, chromosomal abnormalities. Chorionic villi biopsy is done to detect any abnormalities in the chromosomes. Next, question number 11. Complications of chorionic villus biopsy is done to detect. Options are number A, abortion, B, infection, C, preterm labor, D, all of the above. The answer is all of the above. Question number 12. Aspiration of fetal blood or fetal tissues is made for detecting all except. Options are number A, diabetes mellitus, B, hemoglobinopathies, C, thrombocytopenia, and number D, hemophilia. Aspiration of fetal blood or fetal tissues is made for detecting all, that is hemoglobinopathies, thrombocytopenia and hemophilia, except for option number A, diabetes mellitus. Moving on to our next question, number 13. Estriol is synthesized in. So what is estriol? First, let us know. Estriol is an estrogen which is one of the metabolic products of estradiol. So estriol is synthesized in, options are number A, amnion, B, chorion, C, placenta, and option number D, decidua. So our answer is option number C, placenta, as the estriol is synthesized in the placenta. Our next question, number 14. Estriol estimation is useful to detect. Options are number A, post-term pregnancy and PIH, B, diabetes, C, multiple pregnancies, and option number D, Rh isoimmunization. Answer is option number A, post-term pregnancy and PIH. Yes, estriol estimation is useful to detect any kind of post-term pregnancy and pregnancy-induced hypertension. Question number 15. At term, estriol level is about dash mg in 24 hours urine. Options are number A, 20 to 25, B, 40 to 45, C, 10 to 15, and number D, 5 to 10. The answer is option number B, 40 to 45 milligrams. At term, estriol level is about 40 to 45 milligrams in 24 hours urine. Question number 16, HPL. Okay, so first let's begin with what is HPL. HPL is the human placental lactogen. It is a hormone that is released by the placenta during pregnancy and acts as an insulin antagonist. And what is an antagonist? An antagonist is a substance which interferes or inhibits the physiological action of the other. So our question is, the plasma concentration of HPL depends on the. Our options are number A, functional mass of the placenta, B, functional mass of the amniotic fluid, C, functional mass of decidua, number D, none of the above. क्योंकि HPL that is the human placental lactogen ये रिलीज़ होती है प्लासेंटा के द्वारा और वो भी सिर्फ प्रेगनेंसी के दौरान, तो इसकी जो प्लाज्मा कंसंट्रेशन है वो निर्भर करेगी हमारे प्लासेंटा की ओर. तो हमारा आंसर होगा ऑप्शन नंबर ए, फंक्शनल मास ऑफ द प्लासेंटा. Our next question, number 17. Estimation of HPL is useful in all except. Options are number A, pregnancy-induced hypertension, B, post-term pregnancy, C, intrauterine growth retardation, and number D, diabetes mellitus. जैसा कि हमने पहले क्वेश्चन में पढ़ा था, HPL has an anti-insulin properties, जो कि इंसुलिन के विरुद्ध काम करती है, तो इसलिए डायबिटीज़ में ये हेल्प नहीं करेगी. Therefore, the estimation of HPL is useful in all except our option number D, diabetes mellitus. Moving on to question number 18. Pregnant mother's urine contains, options are number A, HCG hormone, B, progesterone, C, estrogen, and number D, none of the above. The answer to our question is option number A, HCG hormone, that is the human chorionic gonadotrophin hormone. It is present in a pregnant mother's urine. Question number 19. The LS ratio is the test done. So first let us begin with what is the LS ratio. The LS, that is the lecithin sphingomyelin ratio, is a fetal amniotic fluid to assess for fetal lung maturity, and the normal value is 2 to 2.5. So this test is done to detect, options are number A, to detect lungs maturity, B, to detect fetal well-being, C, to detect open neural tube defect, and number D, all of the above. जैसा कि मैंने आपको क्वेश्चन के साथ बताया, द लेसिथिन स्फिंगोमाइलिन रेशियो फीटल एमनियोटिक फ्लूइड से बनी है and it is used to assess for fetal lung maturity. Therefore, the answer will be option number A, to detect lungs maturity. Moving on to our last question, number 20. Lecithin is to sphingomyelin ratio should be, options are number A, less than 2, B, greater than 2, C, equal to 2, D, none of the above. Since lecithin is to sphingomyelin की रेशियो 2.0 to 2.5 नॉर्मल होती है, तो हमारा आंसर होगा नंबर बी, ग्रेटर दैन 2. So hopefully this video was also helpful to gain all the necessary information you wanted for, and if you did like my video, give it a like and do subscribe to stay updated with the latest videos of mine.